Well, it's time now for our health report, and joining us now is Africa 54 health correspondent Linord Moudou. Hello, Linord.
Hello, Vincent. Aid agencies are increasing efforts to prevent new cases of malnutrition in South Sudan. Observers say months of fighting and deepening food shortages have left many civilians with nothing to eat in parts of the country. Agencies say the rates of global acute malnutrition are still alarmingly high, well above the emergency threshold of 15% in most parts of the country. UNICEF and the World Food Programme have launched a joint nutrition response plan covering all states in South Sudan. Both agencies and their partners will assist over 2 million people, including children, pregnant women, and new mothers, receive treatment and prevention of acute malnutrition in the country until May 2016.
We are committed to provide services across South Sudan, but particularly focusing in the 3 conflict states because the rates are so high, as well as in states which have very, very high rates of malnutrition.
Now to Ebola. The World Health Organization says it is possible to have 0 cases of Ebola by the end of 2015. However, recent cases of Ebola are still raising concerns about ending Ebola once and for all in West Africa. The World Health Organization says it is possible to have 0 cases of Ebola by the end of this year. Dr. Bruce Aylward is Assistant Director General of the WHO.
Our goal is 0 transmission in the human population, and I think that remains very possible within 2015.
However, the WHO says the risk of reappearances of the disease remain in Guinea, Liberia, and Sierra Leone. Tight surveillance and tracing contacts of infected people remain crucial.
Remember, for many countries, they're thinking, or ministries or health facilities, is like, oh, we hit 0, let's go do all the other things that we haven't been doing. So phase 3 is really all about how to prioritize those things and make sure they don't get dropped and that any residual risk is managed.
Over 11,000 people have died in West Africa since the worst Ebola epidemic on record began over 18 months ago. Liberia has been hardest hit with over 4,800 deaths. The country has also had the most success in bringing the outbreak under control. Liberia was declared Ebola-free in May, but a fresh cluster of cases appeared nearly 2 months later. The country's last case was subsequently discharged on July 23. Liberia was recently declared free of the Ebola virus for a second time and has entered a 90-day period of heightened surveillance.
Today, the World Health Organization declares Liberia free of Ebola virus transmission in the human population.
Today is a day to celebrate, but we must not forget what we have learned. As long as there is one person with Ebola in our region, Ebola is still a threat. The Ministry of Health and its partners will continue monitoring Liberia's borders and rebuilding the healthcare system to ensure that Liberians remain safe. Measures also have been taken to improve surveillance and monitoring in the 15 counties for Ebola and other diseases.
Scientists say sexual transmission is the most likely explanation for the resurgence in Liberia, since the virus can live on in semen beyond the usual 21-day incubation period. The World Health Organization advises that all male survivors should be tested 3 months after the onset of symptoms and then monthly until they know they have no risk of passing on the virus through their semen. Guinea and Sierra Leone are still struggling to end their outbreaks. The latest flare-up in a village on the northern border of Sierra Leone followed the death of a 67-year-old woman late last month. Dr. Aylward says vigilance needs to be maintained in all 3 countries. Health authorities in Sierra Leone quarantined hundreds of people in northern Sierra Leone on Monday after a teenage girl died of Ebola on Sunday. Joining us now on the phone from Freetown, Sierra Leone, is Natalie Van Gijsel, Advocacy Manager and Liaison Officer for Doctors Without Borders, MSF, Sierra Leone. Ms. Van Gijsel, welcome to Africa 54.
Hello.
Hello. Please tell us about the current situation in northern Sierra Leone. What is happening right now?
Well, the response is happening in Bombali district, where the current case has appeared. At the moment, there are many people put into quarantine, But in any case, it's critical to investigate each case and identify the persons that had contact and are now at high risk. And then quarantine measures, they should be kept to a minimum.
Now, the case of the teenage girl who died on Sunday is said to be an apparent case of sexual transmission. What do we know about that?
The exposure of this new case is still under investigation, so we cannot just assume sexual transmission. It is also highly possible that some cases have been missed. Many districts do not report on sick patients now. We are in the middle of a malaria season, and malaria symptoms, they resemble Ebola. So we should see more reports coming in of people that are sick.
So at this point, what are the priorities? Contact tracing, trying to determine what the infection, where the infection came from? What can you tell us about that?
Well, first of all, continued vigilance is necessary until the very end of the outbreak. So a strong surveillance and reporting of cases is critical so that the transmission can be broken. Everybody needs to keep up efforts until we get to and maintain 0 cases for 42 plus 90 days.
There was the case of an older woman who died a few days ago, and that case has nothing to do with the teenager, obviously.
I haven't heard about this case. I have no news on that.
Okay, so what can you tell us in terms of what MSF is doing to contain this current outbreak?
Well, at this moment, MSF rapid response teams, they have been deployed to help the authorities contain the outbreak. And they are in Bombali district responding with other partners.
So you are presently in Freetown. What can you tell us in terms of some of the measures that are in place to ensure that the outbreak doesn't really spread in the capital city and other cities surrounding it?
Well, there is a coordinated response, and all partners are participating in this. And yeah, so the measures that are there, the case investigation needs to be very thorough, then all the contacts need to be traced so that we can identify high-risk and low-risk contacts, and these are then being monitored. If people are suspected, they are being transferred to the Ebola treatment unit and they are tested there. So this way we can break the transmission. Okay,
Ms. Van Gijsel, thank you so much for joining us. And that was Natalie Van Gijsel. She's Advocacy Manager and Liaison Officer with Médecins Sans Frontières in Sierra Leone. Back to you, Vincent.
Well, thanks a lot, Linord. Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.